Jan, yeah?
I think we need to be very careful. I'm very scared. I'm a mother of a disabled child whose child had an operation, a very serious operation, many years ago. I think if we start fighting amongst ourselves, we're on a hiding to nothing. I've read an awful lot of comments by doctors themselves who say they don't want this. We need to garner the support. This is going to hurt all of us. It's no good going back and saying I did this or I didn't do that or the rest of it. Actually, whatever we did, it's kind of irrelevant now. We need to save these services because we're all going to suffer. We need to save the NHS because without it, I work so hard. I know the rest of you work so hard. On average wages, we won't be able to afford to have our children have brain surgery, which mine had to have. The NHS saved my son's life. And mine, actually.
Anybody else?
Yes, hi. I'm Kate Sweeney. I'm from the local Green Party. But I'm also an NHS clinician. I've been a speech and language therapist working in the NHS for 25 years. And I share the concern that everybody's expressed, and I would echo what the last speaker said. I think it's very important. Linda and I represent different political parties, but we agree on this. And let's stick to what we do agree on. We've got differences in other ways, but let's stick to this. I wanted to try and move things on a bit, actually, by talking about how do we take things further. And yes, absolutely, let's keep campaigning, let's keep writing to MPs, to ministers, let's keep on their case because they are wobbling. People will have noticed yesterday Mr Lansley had a major wobble. On that note, I'd like perhaps if we could talk a little bit about how we actually counter some of the arguments. And I'm not going to go on and on, you'll be pleased to hear, but the one that always gets me, which it always sounds so reasonable, it's a Tory thing of what's wrong with patients being involved in their own care? That's a Tory soundbite. It's one that we hear a lot, and the answer is absolutely nothing is wrong. I'm a patient like all of us, and I want to be involved in my own care, and I want to have a lot to say, and I want to be able to ask my doctor questions, etc., etc. Absolutely fine. Where that breaks down is that it doesn't work. What works well for me, for example, and for people in this room, won't necessarily work quite as well for everybody. And the example I like to give from my own experience is a young single mum whose little boy needs an operation, and she's got lots of questions about the operation, but she's got slight learning difficulties, and because of that she hasn't got the confidence to ask the questions, and because of that the care of her little boy is quite severely affected. And that's the problem with that particular argument. What's wrong with patients being involved in their own treatment? Nothing, but we've got to make sure that there's a real danger here that we're going to end up with a horrible two-tier system like they have particularly badly in the States, but also to a lesser extent even in other European countries, where you'll hear about how wonderful it is in other European countries. And yes, for most people I think it probably is, but for some people it isn't. And what's great about the NHS is that we all have, at least in theory, and yes, there are problems, I do accept, but at least in theory we all have equal access to it. And I desperately, and I think everyone here, we desperately want to keep that. And we've got to make sure we stay united and that we make the points, because Lansley is scared, he's worried, David Cameron's on the verge of dropping him, he's becoming the black sheep of the government, and we've got to, and I hate to talk like this, but I've got nothing personal against Mr Lansley on a personal level, but we've got to make sure that these plans are scotched.
Thank you.
I mean, I will talk towards the end about how you could find out more information in detail to enable you to refute many of the arguments that will be put forward. And there's some excellent websites, not just from the trade unions, but things like Health Emergency, and I brought copies of their paper there with their web address and so on. But the point about choice is something I do want to comment on just now, and thanks for raising that. There's two things that are inherently wrong with outright absolute patient choice in health as well as education. and that is for you to be able to choose that you can take your child to go to that hospital for that thing. That hospital's got to be in a position to accept that in the timescales that suit you. That means you build in some sort of spare capacity. Now, we cannot operate on a spare capacity basis. So the pure essence of choice in its proper literal interpretation is a falsehood. It just can't apply like that. But the aspect of choice that I really want to focus on is about GP consortia. Because the GP consortia can actually say, these are the services that we're going to provide, and this is the budget that we're telling each of the GP practices who are in this consortia, that this is how much you can spend in this month. This is the number of referrals you can make. It gets even worse when the private sector comes fully into this, because in Hounslow and West London, the GP consortia that's there has United Healthcare, a US company, doing what's called, and I hate this, a referrals management service. Now, when you haven't made your choice of that hospital or that hospital that the GP's provided you information about, the GP doesn't send a letter to Mr. Bob Hayes, gynaecologist. It sends a letter to United Healthcare Referral Management Service to find out if their accountants and so on believe that this is the right thing to do. Perhaps we might refer it back to the GP and suggest an alternate, cheaper way of dealing with this situation, or saying, hold it back till next month's budget allocation. And that, in essence, is really what's facing us, as far as the wording of the legislation currently stands. I'm hoping that, that all that does get amended. There are many other aspects to do with that, but I don't want to occupy all the time tonight.
My name's Mike Foster. I just wanted to talk about what's happening now. I know that these proposals are going to radically impact upon the NHS, but the cuts the government are already imposing, and the previous administration, are to the tune over the next 3 years of £20 billion. The estimates are that 1 in 8 nurses are going to lose their jobs over the next 3 years, and that there could be as many as 50,000 jobs disappear in the NHS, and that is their current plans. And at the same time they're talking about all the PCTs disappearing. They sacked 1,800 managers, now they've re-engaged them all again because of the pause, but there is chaos at the top, but at the front line jobs are disappearing and people aren't being replaced. So the NHS is already in a dire state, and I think it is imperfect and there are things that can be done to improve it, but probably different to how the government would perceive them. I think that the drug companies are a massive leech on the NHS, and they are draining the NHS of billions of pounds of public money, and that they should be in the public sector along with the NHS. I think that private sector agencies who are offering staff to the NHS because there aren't enough staff are also a massive drain on resources, and those agencies should be driven out of the NHS. I think that private sector care within the NHS should be abolished, because again, it is part of the public sector, and the private finance initiative is pernicious, because again, it is private sector companies that are top slicing the NHS budgets. And if we want a plan, I would say if we did all of that, the NHS would be billions of pounds better off, and we would ensure that its future was safeguarded. But that isn't part of this government's plan at all. It's completely the opposite. I think the idea of a social enterprise trust sounds extremely attractive. Social, yes, we like that. Enterprise, well, yeah, maybe there's a spaceship that flies around the universe called the Enterprise. This might be a good idea. Trust, well, maybe we can trust them. But a social enterprise trust is a clever label for privatisation, as the speakers have explained. And we're on a dangerous shoot, and at the bottom of which, when we get there, people say, how the hell did that happen? And therefore the situation is urgent now. We face a crisis. And I'm part of the SOS, very proud to be part of the SOS, and I think we've called this meeting tonight because if we're going to defend the NHS, it's up to us. Don't leave it to the politicians. It's up to us, ordinary members of the public, to come together. We've said on the sign-up sheets, if you want to be part of an action group, please sign up and develop a plan of action. I was part of the Save the Huddersfield NHS group, which demonstrated in their thousands to stop the destruction of the NHS there, and people will come out again. I'm absolutely convinced when they hear the arguments that come out on the streets. And what is this government afraid of? They don't want people power, do they? They tried to dismiss the demonstration that some of you were on the 26th of March, but there were thousands of health service workers on that march, and they were saying, we've been to London, what are we going to do next? And what are we going to do next? Because this is a fight, the like of which we've never been in before, to save our NHS. We have never been in a fight as grave as this. I work in education, and it's just as bad there, but this is about the NHS. The trade unions, I hope Paul will say more, but the trade unions jointly should be combining together to call days of action, days of protest, and if necessary, 24-hour general strike action across the whole of the health service to say we don't want you. This government's rattled, and I think they'll be defeated by the end of the year if we show our determination. They're rattled by a few people saying this isn't a good idea. That's what they're rattled by the, quite rightly, the BMA, the RCN, not militant bodies, very respectable bodies who've come out and said this is a bad idea, and Lansley's already on the run. If they see thousands of ordinary people demonstrating in support of the NHS, they'll be defeated. So I hope that you will tick the sign-up sheets, say yes, you want to be part of the action group, and we will pull people together again. We'd like to have a day of action in Halifax to kick the ball rolling and to explain what this means. But we don't have to go into the detail of all of the government's proposals. The cuts are already happening. Wards are closing down. People are concerned. We can mobilise people, but it means ordinary folk like us getting off our butts and getting active.
Anybody else?
I just want to ask the panel, just carry on from what you said, is the success of stopping the forestry privatisation, where the middle classes rose up. Because when the middle classes rise up, the Tories soon listen. Not that they're actually not still selling some of the forestry commission behind the scenes, because Cameron's a lot slimier than Thatcher ever was. Thatcher was a nasty piece of work, but you knew where you stood with her. Cameron will say what you want to hear and still do it. That's one of the big problems with Cameron. But I just wonder what the panel thought about, in terms of SOS and everyone, about how we can garner that middle class that scares the Tories into quick change.
I honestly think the biggest thing is awareness. Because as I said earlier, I think the analysis in terms of the general media, now we know that the media is not necessarily on the side of the public sector in general, but in terms of the NHS, it is like a sort of sacred cow to the British people. I mean, Thatcher didn't privatise one item of clinical care, and she actually was on record as saying the British people wouldn't stand for it. There would be a revolution. If ever I'm in town doing a petition for a particular NHS issue, people queue up. You know, it doesn't happen on any other issue. So it's increasing the awareness. But you've got to arm yourself with the facts about this as well. Because it's so easy for people to rebuke what you're saying. But there's lots of information, like Unite, Unison, the Royal College of Nursing, BMA in particular has got a very strong website on this. But there's also websites like Keep Our NHS Public, Health Emergency, detailed analysis, detailed information about the bill. And most people outside of this room still do not have an awareness of the intricacies that are involved in this and what the ultimate destination, if it goes through as it is going to end up with, which is going to be the end of the NHS as we know.